we're going through this process and coming out of like the major like chicane that we were in, like my point was like the reimbursement piece. Like it is important for us to advocate for us, but we also have been advocating. So it's really important for folks like you to be like, especially if you're working for the state or in government, to make sure that those messages like language access, reimbursement, like small organizations like us, we can't really sustain ourselves on literally nothing. These messages need to go on up, and we can't be the only people to do it. You know, like we keep getting this message like, oh, well, we work for the state, so we can't really do anything about it. It's like, but yes, you can. You can still talk about it on a regular basis that this is not working for us. So I just wanted to note that because thinking about, you know, the future. To interrupt, can I jump to Lakia quickly? I'm gonna talk to them a little bit. I want to make sure you get your words in.
So, you know, before the pandemic, you know, we did have a BIPOC community, but what's BIPOC? Who are they? You know, it wasn't really recognized who we were. Once the pandemic hit and COVID was affecting us the most, everybody's like, oh my goodness, we got to get them vaccinated. We got to get them this. We got to get them that. Let's help them do this. The Vermont language access was tremendous help. It was a tremendous help. And
Allison,
yes. And that was, you know, being able to get everybody in and get them taken care of. It like you said, it was like a crisis so everybody was like doing stuff for all the BIPOC people. And now that we're coming like to it's not over, but like kind of like a standstill right now, and it's becoming like a new normal. You know, we're going back into, well, why do we have to do anything for them? Why do they need this? They don't need this. Let's take this away from them. You know, and trying to still provide access to languages that's even turning back again. You know, trying to be able to provide food and housing. You know, it's more of in the last 2 years, we've had a huge increase in BIPOC community members moving into the Rutland area, and it's, you know, all of our resources are going down. So it's still, you know, things need to, like, I feel like it needs to be a crisis like all the time. Like we should feel like we in crisis all the time just to be able to give the services. You know, I feel like everybody needs to be serviced, of course, but you know, being a BIPOC person myself, the healthcare field needs to be more aware of the different services that we need to be treated differently. Our medications given to us need to be studied on BIPOC people so that we know what reactions are going to happen. You know, I have a little one that has multiple medical problems, and we come here to UVM, and his doctors are phenomenal. They have taken my suggestions and any medications that he's been provided. They research it before they like, oh, you know what, I didn't think about that. Let me take that in consideration. Let me think about that, and I'll get back to you. I'll get you those numbers. And before he can be provided any medication, I won't let him take anything that hasn't been studied on a BIPOC person. Because I need to know those numbers, and we need to get back to, you know, that type of health care. And then, unfortunately, in the Rutland County area, it's not being provided.
And to your point, like, it is a fast-growing population, right? From 2010 to 2020, the BIPOC community increased by 125%. And that's not in the Chittenden County area. That is in Rutland, that's in central Vermont, that's in Brattleboro. So I think there needs to be this recognition that, yes, we are spread out, but it is a rapidly growing community, and we do need to have the appropriate services offered.
And to finish that point off, we talked about this a lot at VHEI, that all those people are constituents, they are voters, they are taxpayers, just like everybody else. So if people are paying their tax dollars into a system that's supposed to protect them, that's not protecting them, then really we're just taking people's money away. So, but to your point, before, during, and after, I think there are a few things that didn't change as rapidly as they should have. And this reimbursement thing we're talking about, just so everyone understands, a lot of times when federal and state dollars and even like big institutions give money, they expect it, you can only retrieve that money, your small organization, if after you spend it, you can get reimbursed for it. But in the clinics, all of us are spending our own money to get people to this thing, to pay for Ubers, to pick them up, to whatever, we have staff and people volunteering, and there's food at the event and all this stuff, and it's coming out of our own pockets.
For months.
For months. And the reimbursement process then takes another few months, and that's what we're talking about. The assumption is none of the organizations or the people have money. So I think that's the baseline. Assume that no one has money, and that the money, just like any business transaction, comes up front, or half up front, half in the middle, whatever. So just so everyone understands what that concept is that we're throwing around. That hasn't changed. I haven't seen that change in government institutions that much. I will say Marilyn Matthews was able to support us in changing that at the City of Burlington.
Yes. And
VHEI benefited from that. Vermont Racial Justice Alliance benefited from that, and we're lucky to have that type of change we see in the City of Burlington. So that's one thing. The other thing that hasn't quite changed is internal language access infrastructure. We have groups like the Vermont Language Justice Project that are doing the work of the state, that the state should be doing for its communities. But it's an external body that's doing it. It's not in the infrastructure of the organizations themselves, and I think that is important. But if we'll flip it to things that have changed that are good, one of the biggest things that's changed, and the reason why our group VHEI is able to be successful, is we developed relationships with people who have power and money, and some of those people have really stuck with us. And we have to Thato's point, I'm really grateful for those relationships, because that's the reason we're still able to fund what we're doing. A lot of those people have elevated our stories up. The reason why we're in panels like this or whatever, people know who we are, is because of those relationships. So there are key people in some of these institutions that have been with us through that, and those sustainable and meaningful relationships are what kind of make transformational change as far as racial equity goes. So we couldn't have done it without those groups as well.
Can I just say one last thing, that we can no longer afford to have surface conversations, to talk about issues and not act. For things to change, we have to act. And we cannot do it as the organizations that serve minority populations. We have to do it together as a community, because we are one. We may look different in terms of color, but at the end of the day, it's humanity. We are feeding off of each other. We are learning from each other. We are exchanging this beautiful cultural thing going on in Vermont that has never happened. The tapestry looks beautiful. And it's important that we ensure that we are all healthy as a community. We function as a community. That has to continue. We have to get beyond just talking, going to conferences, talking about issues and not doing anything. And for that to happen, is each and every one of us responsibility to make sure that it happens. We have to keep each other accountable. It cannot be about minority serving organizations implementing and always coming up with suggestions. We all have the ability to think through processes, to reflect on how the systems have been and how we can do things differently to ensure that everyone is part of, because we are a community. We are here to stay. We are Vermonters.